The U.S. continues to be ranked last among industrialized nations as far as access to health care.
It's shocking. You know, out of all, I mean, we're ranked 37th in the world according to the World Health Organization in overall quality of care. And it's not that we don't spend enough money. We spend $9,000 per person per year. A country like England spends like $3,000 per person per year, and they're ranked much higher than we are. It's incredible. It's because we've commercialized medicine and forgotten about medicine is supposed to be about service.
So Americans distrust healthcare, our
Well,
healthcare system.
it's about time.
But the majority still do like and trust their doctors.
Yeah, part of the reason why they haven't done much more about it is because of that. I mean, doctors are good people trying to do the right thing, aren't they?
Well, yeah, because a lot of our doctors aren't happy with the medical industry either.
No, it's never, the morale has never been lower. So here we are.
And then to add to the confusion, the American Medical Association favors the doctors over the patients, although in 2012 they stated that their vision was patient-centered. And we are going to cut through the confusion of all this commercial nature in medicine.
Well, that's right. You know, I have a good friend who was a past president of the American Medical Association. I can assure you his goal is to make health care the best it can be for people, for the patients.
For the patient.
Yeah. I would have to say the organization in general, from my perspective, however, doesn't come across that way. It's more like the AMA is sort of like a union, not quite, certainly not quite. And what we need is an organization that's going to represent patients more. And where are we going to get that? I would wish that doctors would do that. And we tried to start a union back in the early 70s, and that went over like trying to herd cats to get them into a union. It just wasn't going to happen. But now that things have gotten as bad as they are, we're in a terrible position. Doctors have lost their power. They now work for other organizations, big HMOs and the government, and they're losing their ability to be able to individualize their treatment for people depending on who they are.
Well, what about the American Academy of Family Physicians? I mean, they have policies aimed at treating the whole person.
Yeah, a lot of
And
this,
they said they were aiming for better care and
well,
better
you know,
outcomes.
people
and
say all
lower
kinds of things.
money.
And why would a medical organization say, oh, no, we're just out for us? They're going to do advertising like every other
Yeah, all the
organization does.
do-gooders.
All the other do-gooders. And it's not like they wouldn't like to have health care be as complete as it could be and holistic and person-centered and preventive. I think that in general they would. But working conditions, wages, the way patients are treated has taken priority. And now it's gotten out of hand. And it's been about 20 years that it's really been out of hand. So the business of medicine has taken over.
Well, you know, we've talked about this before, but what about universal health care?
Well, that's a must. We're the only industrialized country in the world that doesn't have universal health care, which is shocking.
But
And-
it's not perfect either.
No. What does it do? It's delivering a healthcare system that is just like the one that we have, except to everybody. Now, everybody's entitled to health care. And universal health care, in my opinion, is just something that goes with being a citizen of any country.
Well, people complain with universal health care that they have to stand in long lines for surgery.
Well,
But we have to be in lines, so to speak, you know, to see our
Yeah.
primary care physicians.
Yeah, that's true. I think that what we need is a system that's different than what it is in terms of what its priorities are. We're more focused on the economics of medicine. We're not so much focused on giving people what they need in terms of looking at the cause for disease. We hardly ever really do that. Nor do we look at what they need in order to get well and stay well and practice preventive medicine. That's how the healthcare system needs to shift. And there is no country that I know of, maybe with the exception of a country like Bhutan, where they give free health care and free education to everybody. They're on the right track. In fact, Denmark does that too. They give free college education, free health care, and they will take care of people who are poor people. They don't leave them on the streets like we do.
Isn't that wonderful?
So move to Denmark if they'll let you in.
So where does Obamacare fit into all this?
Well, Obamacare is a tragedy. The problem with Obamacare is that it started out being something that sounded good. Back in 2009, President Obama's platform was that we'd have universal health care. So it would be much like Medicare for everybody. And that would be a step forward. because health care for the poor is not very good. It's not accessible to them very well, and the quality of the care is far less than people who can afford to pay for their own health care. But that all got diluted. And what we wound up doing is moving from a place where Congress was supporting universal health care, the American public, 2/3 of us wanted it, the doctors wanted it, and then came the nitty-gritty. The insurance companies didn't want it. The pharmaceutical companies didn't want it. And that's where the big bucks are. And so they poured a lot of money into changing the opinion of people in Congress by making major donations to them.
And lobbying.
Well, lobbying, you can call it lobbying, that's kind. It's really a huge conflict of interest. It's bribery is what it is. And everything changed. And then we wound up with this thing called Obamacare, which is a mild step in the right direction. But it's far from offering integrative, holistic, person-centered preventive health care. It's a mile from that. So we're in trouble. And that's what this article in the New England Journal of Medicine showed in the year 2014, in October of 2014. They looked at 29 different countries, Vicki, and the U.S. was tied for 24th with Croatia for how people trusted the profession, the medical industry, and the doctors included. And we have a general mistrust about institutions in general and corporations because they're trying to take from us. They're not really trying to give us anything. They want to sell us stuff, but it's not really necessarily for our benefit. And then they looked at and found out that about 40% of the population did not believe that MDs could be trusted in the U.S. Only 25% felt that way in most of the other countries. So we have a long way to go to improve our image, and we will not improve our image until we improve how we approach providing health care. It needs to be a service, not a business.
The patient needs to come first.
Exactly. So until we shift from that perspective, it will continue to be a business. Doctors got sucked into participating in this because they didn't want to mess with the economics of medicine. They just wanted to practice medicine. And now they work for hospitals and they work for insurance companies and big HMOs. They've lost their ability to be able to provide care the way they want to.
They're puppets in a lot of ways.
They have become puppets indeed. And that's where medicine is today. So until we evolve to a higher level where we're interested in providing service that's good rather than something that provides income, healthcare is going to continue to stay right where it is in the U.S.